So now it gives me absolutely great pleasure, again, to introduce another fantastic speaker. And her name is Gráinne Evans, and she's a full-time mum of 4. And she's over 11 years of personal breastfeeding experience. She's been involved with the Leche League since 2011 and has been an accredited leader for 5 years. She runs breastfeeding support groups in her hometown of Mahara in South Derry. Through sharing her experience breastfeeding her 3rd baby, who has a tracheostomy, she's become a passionate advocate for the improvement of breastfeeding support for babies born with extra needs and the rights of every baby to receive breast milk. She created and runs the only online support group for people with her daughter's rare condition, and she supports families all over the world. Gráinne assisted doctors in Boston to connect with enough participants to complete the genetic research that led to this condition's full classification in 2017. She's also passionate about birth and baby wearing and writes breastfeeding poetry in her spare time. So I'm going to hand you over now to Gráinne Evans.
Hi, hello everybody. Thank you so much, Leche. That was lovely. So I've never done a Zoom conference like this before. I've never spoken at one. So I am just going to try and imagine that you are all real people out there. And so I'm going to share my screen now and hope that this technology all works the way it's supposed to. And okay, I think that's working for everyone. Everyone should see the first slide there. So the title of my talk today is Breastfeeding Your Child with Extra Needs, the Challenges and Solutions. So that's a big topic. That's kind of heavy and emotionally charged, but it is one that I have some personal experience in. Because on Valentine's Day 10 years ago, my 3rd baby, Tessa, was born with a really rare genetic condition, which is now known as BAM syndrome. Basically, she was born without a nose, and she has a tracheostomy tube as a 2nd airway. So throughout this talk, I'm going to be sharing our story. Spoiler alert, she was breastfed. And I'm also going to explore some of the general challenges that families face when breastfeeding with additional needs, what can help them succeed, and why this is something that everyone in healthcare should care about. So extra, read all about it. The message is this: breastfeeding when a baby has a disability or additional short or long-term health complications has all the regular obstacles that mothers face, plus loads more. But while extra support, extra time, extra effort may all be needed, breastfeeding can be so much more important for these babies and their mummies, and it can have the greatest impact. The awful fact is that those who need breastfeeding the most are some of the least likely to get the support that they need. So my goal is that you leave here today with more understanding of some of the complex issues, kind of more empathy for the families facing this journey, and more confidence and motivation for how you can support breastfeeding in these really unique circumstances. Now, what I can't do is just give you a magic solution or tell you how to fix every problem, because I'm not a doctor or a magician, but I am a mother. And I can make it personal because for me and many others, it is personal. So meet Tessa. Tessa was our 3rd baby in 3 years and a VBAC birth that I had fought really hard for after 2 previous cesarean sections. But when Tessa was born, we had no idea about her condition and we were expecting a typical baby. That meant that her birth was a huge shock. I remember freezing in fear when I lifted her from the water in the birth pool. And when the birth team saw her face, they began pushing alarms and shouting for help down corridors. The panic and shock of seeing her and not knowing what it meant, not knowing if she was going to live or why she looked different, was completely traumatic and overwhelming. I had never seen a baby like Tessa before. Few people ever have. I did get one very brief cuddle before they took her away to NICU. And even though I have that picture, I don't actually have any memory of it at all. I was completely in shock. I was terrified and heartbroken. And then came the realization that I wouldn't be able to breastfeed this baby. A baby needs 2 airways to nurse. I remember how physically painful that realization was, and how utterly alone and empty I felt without my baby that night. It was an intense grief, followed by waves of guilt for feeling the grief because my baby was still alive. Tessa, meanwhile, was all alone in an incubator in NICU and would have already had several painful procedures carried out as doctors ran a host of diagnostic tests and scans. She had a feeding tube and a tube to keep her airway open, taped to her face. Now, I rarely got to hold her in the first few days. There was no skin to skin at all, and I was terrified of all the tubes and wires that she was attached to. I was expressing my milk every couple of hours and through the night, and I insisted on staying in hospital while Tessa was there. But that was a daily battle where I was told that I needed to go home and rest, that Tessa didn't know I was there anyway, that my other children needed me, as if that wasn't something that I was carrying the guilt of every moment of every day anyway. I wished that they had understood that not being able to hold her all day was constantly stressful and painful for me, and that sending me further away would only make that worse, and that it wasn't what was best for either of us. Everything felt wrong. We were told that Tessa would need surgery to give her a tracheostomy tube, an idea that took a lot to come to terms with, but with it came a glimmer of hope, because somebody told me that if she had 2 airways, maybe she could breastfeed. Maybe was all I needed to hear. I had hope. Now, sending an 8-day-old baby to surgery is something that I wouldn't wish on anyone. But it was successful. And we finally got to see her gorgeous face without all the tapes and the tubes and the wires. And crucially, we weren't in NICU anymore. And for a week in that pediatric unit, I was free to lift and hold my baby girl as much as I wanted. I don't think I put her down at all that first day. I nearly gave myself a UTI. My milk supply took a giant leap, and if you could measure mental health, I would have pumped more of that too. After 48 hours, I was allowed to try to feed her. And after some time trying to position her so that I wasn't hurting her neck with her new trachea tube, she actually latched. She actually latched and fed. And that feed, honestly, would keep me going through so much of what was to come, because I knew now that she could breastfeed. And that was going to keep me going. In our story, though, like many others that involve medical issues, progress wasn't linear. After a week, Tessa was sent back to the NICU, and things became much harder again. We weren't sent back to NICU for any medical reason, though. She was completely stable and needed none of the expensive medical equipment that surrounded her. But because of unbending hospital policy, we were forced to stay where I couldn't have visitors, where I felt I had no control or privacy, where getting her to feed at the breast was not a priority, and where I was constantly made to feel like I was in the way. The lack of family-centered care was profound and damaging. Tessa was fed large amounts every 3 hours and was throwing up a lot. Her consultant wanted to add thickener to help her tolerate her feeds and fortified formula to help her gain weight. Whereas I simply had kept asking to feed her smaller amounts more often and to feed her sitting upright. I was told no repeatedly and patronizingly, and my attempts to breastfeed were less and less successful. Life in the NICU was wearing me down, and my confidence was being shattered. Everything felt wrong. I was dealing with constant pressure from staff to leave and go home. I was reeling from new diagnoses of multiple eye conditions. I was still living in a vacuum of information about what her actual medical condition was or what it meant for her development or future. And I was still crying every night at the thought of what she'd have to go through in life. Eventually, I did convince them to let me tube feed her in a sling sometimes, upright and too early, and it unsurprisingly reduced the vomiting and her weight gain increased. Enough for us to get out of hospital. And I do need to mention that there were some truly incredible nurses who I will always be so grateful for, who went out of their way to help us through what was mainly a miserable and traumatic 5 weeks. At discharge, Tessa was on 3 hourly tube feeds, and I was trapped in a grueling cycle of feeding and expressing. Now, sadly, my experience is not unique when babies are born with medical issues. Most mothers are beginning this journey dealing with a cocktail of fear, trauma, shock, guilt. They are so extremely vulnerable, and they're suddenly plunged into a world that they don't know and didn't want to be a part of. All their hopes and plans have been thrown out the window, and it takes time and it takes help to pick up those pieces and see a new way forward. It's impossible to fully prepare yourself for how you'll feel or the reality of NICU or special care. And of course, all of the babies are facing their own challenges. With so much to cope with, even before breastfeeding is considered, it is no surprise that breastfeeding rates are so low amongst this population. When we look at specific breastfeeding challenges that babies with extra needs have, there are any number and any combination. And it's really important to note that every baby and situation is unique and will need such an individualized management. So this is not a comprehensive list by any means. It's just to give a few examples of the kind of challenges that some conditions can bring. And I always talk about breastfeeding challenges as having a combination lock and not a padlock. Like, you're not looking for the right key, you're looking for the right combination. And maybe you had the right numbers, but not in the right order. So all of these things are simply tools that we need to use in every situation. Try them all. So sometimes we've got babies that can have heart problems, even cystic fibrosis babies. They could have extra caloric needs, so they're going to need more energy. They may tire easily. And they can develop complex conditions that prohibit oral feeding for a time. They can be fluid restricted while also needing extra calories, which is a really tricky thing to manage. Then we can see babies with hypotonia, which is often seen in babies with Down syndrome, for example. So you've got low muscle tone there that needs extra physical support. You're going to have different techniques that can help, things like upright holds, semi-reclined positions, and that dancer hand to help support the jaw muscles. Babies with cleft lip or palate may have difficulty maintaining latch and suction and require special techniques to increase milk transfer. There's adaptive bottles, feeders, nipple shields. Some dyads might need support because the typical breastfeeding positions are impossible due to surgical wounds, stomas, splints, or in our case, tracheostomy tubes. And here, one of the key things is actually reassurance. Reassurance is a key element of support for parents for any post-surgical babies, because a lot of times parents are really terrified that they're going to hurt that baby by picking them up. So they may want to, they may really be yearning to, but too scared to hold them. So reassurance, and then the help to suggest different positions, different solutions. And this is where we have to get really creative with our ideas and think outside the box for these babies. In Breastfeeding the Brave, which is an incredible book by Lindsay Hookway, which I will reference multiple times throughout this, she mentions a 2-year-old who, after brain surgery, was required to lie completely flat. So for more than 2 days, for several days, her mother fed her by dangle feeding or side lying. She called it the wolf position, the dangle feed position. So I'm sure that there might have been somebody who looked at that baby and said, oh, well, they can't nurse because they have to lie flat. But we can find a way around most things if we just if we stop thinking that it has to look a certain way. So that mother managed to feed that baby while they lay flat, recovering from their brain surgery. And of course, there are some conditions which do mean that supplementation is necessary. And this is when a great deal of tact and empathy is required to support mothers coming to terms with, because it can be really difficult to hear. And some mothers then are going to hear that their milk isn't good enough, that it's not adequate. And again, in Breastfeeding the Brave, Lindsay Hookway suggests helping mothers to view their milk as exclusively feeding their baby and the supplement as feeding the condition or just replacing lost fluids. So in that way, we can think of the supplement as the medicine or as fluid replacement and not as them feeding their baby, which is what their milk is doing. So it just empowers mothers to keep the value on the breast milk that they're producing, which is so important for them to be able to continue. So while certain issues will be specific to certain conditions, there are some things that most of these babies are going to have in common. So generally, there's going to be a period of alternate feeding, like tube feeding, and they're going to need time to transition to breastfeeding. There's probably going to be time spent in NICU or special care. There's the likelihood of early surgery or medical procedures, a higher likelihood of further surgeries, which comes with a higher chance of infection, either from the original and from subsequents. And all of this means that they will have the most to gain from breastfeeding. And it means that they'll all likely have their ability to breastfeed underestimated. So why is it important? Why is it worth the extra effort to feed these babies that have extra needs? So again, for all the reasons that are true for typical babies, plus some extra ones. So for these babies, what we are able to do is optimize health and reach a health potential that might not otherwise have been able to get. So we're going to keep these babies out of hospital for the most that we can. They're going to have fewer infections, recover faster, shorter hospital stays, less medication, and it provides a huge amount of pain relief. I know that Dr. Powell talked about this as well, and I'll talk about it later on, but it's something that I think is maybe seen as maybe a placebo, that it's just something that we think helps with pain relief, and believe me, it's so much more than that. There is real significant pain relief by nursing. So in Breastfeeding the Brave, again, Lindsay writes, children who are unwell may receive many interventions and treatments, but for parents, human milk is a significant modifiable factor that is worth fighting for. Children who are breastfed often have reduced severity of illness, shorter length of hospital stay, less hospital-acquired infection, and fewer complications. This may be related to the active immunological components in human milk, which actively ingest bacteria and support children with passive immunity. So it really is incredible what breastfeeding can do for all babies, and these babies have the most to gain. They just have so much more challenges, and breastfeeding can make such a significant impact. And we can't go on without mentioning mental health as well. So according to research from McMaster University, children who spent time in NICU at birth have a higher risk of mental health issues later in life, regardless of birth weight. So I think that's something that a lot of people believe that was really, like the smallest babies would have the hardest time and have the most impact on mental health later. What the study showed was that it didn't matter. If the babies had spent time in NICU, regardless of birth weight, the risk was higher that they would have mental health issues. And if you find that upsetting to hear, you're not alone. I am all too aware of how upsetting and uncomfortable that information is. The authors did say that additional research is needed and that more data is needed to better understand the causal factors, but it probably shouldn't shock anyone that separating mothers and babies at birth has long-term psychological implications that we don't fully understand yet. So I really do recommend looking at Miracleman UK, which is an Instagram account run by a psychologist and NICU mum. She has some wonderful tactics and suggestions to help parents who are dealing with even just like the confronting information that's there. So we know from studies that breastfeeding is supportive of children's mental health and it promotes connection. And so for children's mental health, it's vital that we ensure all necessary support is provided to increase breastfeeding rates in NICU and for NICU graduates. And then there are parents. I mean, I fully believe that any parent who has experienced NICU or has had a baby with a medical condition diagnosed should be offered psychology or counselling support from a trained professional. As we've seen, mothers who have babies with additional needs or health complications are really likely to experience a host of psychological and emotional challenges. Many mothers are dealing with a profound feeling of loss for the normal experience, grief for the baby they thought they were having, and for the typical postpartum period. Being denied the chance to breastfeed only compounds this feeling of loss. In Why Breastfeeding, Grief and Trauma Matters, the wonderful book by Amy Brown, she says mothers who plan to breastfeed but are unable to, or who experience pain or difficulty that leads them to stop breastfeeding, are more likely to experience postnatal depression. Now, as breastfeeding helps with emotional connection, provides comfort and reduces stress for both mother and child, we need to make family-centered care a priority. So what can we do? How can we give breastfeeding the best chance of succeeding when there's so much stacked against it and the stakes are so high? So I reckon you can boil it down to three things: support, knowledge, and hope. So firstly, we're going to look at support. This is where family-centered care can make all the difference. Mothers in these intense circumstances need so much support. They are the ones sitting alone at night, pumping while tears drip faster than milk, willing themselves not to give up, trying their best to keep going. They need practical and emotional support. With the likelihood of separation or tube feeding comes the need to protect mum's milk supply. And it is so difficult to establish and maintain a full milk supply, and in some cases when they need an abundant milk supply, with so much stress and uncertainty, unless you have good support. Mums need someone who can help them make a plan that works for them. They need someone who will celebrate every extra mil, someone who listens to their fears, someone who understands why they're doing this when others question it, someone who believes in their baby's ability and right to breastfeed, and someone who sees them. Mothers will really typically ignore their own physical and mental pain or issues to care for their baby. For my own example, I had been in hospital for nearly 3 weeks after having Tessa, when a nurse on night shift in PICU discovered that I hadn't been seen by a midwife since I'd been discharged from maternity. I was suffering with really quite severe edema in my feet and ankles from sitting at the NICU stools for 3 weeks. Now, that was painful but not very serious issue, but I had completely ignored it, and I would have ignored many other things. We can't just look at the baby as the patient without acknowledging that it's the dyad that needs cared for. So support and encouragement from everywhere else is needed too. Family, friends, other healthcare professionals, charities, they can all make a difference. Encourage families to seek out any help and support available. This is going to take more than a village. Our second thing is knowledge, the second key element. So we need to find out if it's possible and how it's possible. And this is where we don't assume. So we need to ask the experts, specialist IBLCs, and other mothers. Reach out. So we're so lucky to live in an age where we have access to infinite information from the tiny computers in our pockets. And when it comes to finding solutions to breastfeeding challenges when a child has extra needs, it's often necessary to widen that net way beyond our own locality. Reach out to lactation experts in specific conditions, no matter where they are in the globe, and mine the priceless wealth of knowledge that is other mothers who have been or are on the same journey. We really just need to use the internet to its fullest. There's nothing I love the internet more for than 24-hour online support groups. And Dr. Powell just gave us such a wonderful example of the work that's being done by her incredible group. These groups are making ripples that can change things massively for people. So I'm going to mention a few books that have excellent resources for anyone who would like to look them up. So first, we've got Jack Newman's Guide to Breastfeeding. This has an excellent chapter called Sick Babies, Special Babies, with loads of detailed information on how to manage a host of conditions. Amy Brown's The Positive Breastfeeding book has chapters on breastfeeding a child with health complications and breastfeeding if your baby are in hospital, both excellent. And they include some brilliant mother stories. I especially loved the one story that she has of a mum who was managing to breastfeed her baby who had an undiagnosed cleft palate. Now, she was having loads of issues, but because she was managing to feed that baby, the cleft nurse declared that her baby couldn't have a cleft because she was nursing. She did. Then there's Amy Brown's Why Breastfeeding, Grief and Trauma Mattered. And I mentioned this earlier. Now, this is essential reading for anyone who wants to understand the awful consequences of failing breastfeeding mothers and why this work is so, so important. And then there's Lindsay Hookway's Breastfeeding the Brave, which I have referenced multiple times and will many more. It really is the most powerful and informative book about the challenges and solutions of breastfeeding medically complex children in pediatric setting. It's absolutely worth getting for the mother stories and the beautiful artwork. Every hospital and pediatric team should have at least one copy. Please get multiple. So our third element is hope. So we need positive language and positive stories. Language is so, so important. Anyone who has contact with new parents needs to think before they speak. The language that they use can be etched into already traumatized brains. Believe me, there are things that were said to me in NICU that I will never forget, said by people who have probably never thought of them again. So the idea that some health professionals have that when a baby is born with serious health complications, it's somehow better to not add the stress of trying to breastfeed is dangerously out of sync with reality. It's unfortunately really common for breastfeeding a child with medical issues to be dismissed as a pipe dream. Some people think that you shouldn't get a mother's hopes up, but this mother just had a baby. Believe me, her hopes were already up. So all of this means that the topic is commonly surrounded by negative language and defeatist phrasing. So we need to stop telling mothers who desperately want to breastfeed their babies that they probably won't be strong enough, or it's unlikely after surgery, or babies with this condition usually have problems, or your baby will never be exclusively breastfed, your milk won't be enough, it's too much work, it's not worth the stress. Again, Lindsay Hookway in Breastfeeding the Brave writes, I would urge everyone to not assume that a baby will be unable to feed based solely on their experience with a previous child with the same condition. Allow babies and children to surprise you. And if you take anything away today, let it be that. It is completely possible to be realistic and manage expectations while also respecting the importance and value of breastfeeding to the mother and child. The use of positive and affirming language should be standard. So what should mothers hear? So we can say, well, some babies with this diagnosis have no problems breastfeeding, or sometimes it does take a while to establish breastfeeding, but lots of babies just need that extra time. Babies have gone to the breast even after months. If your baby isn't able to breastfeed immediately, we'll show you how to express and build your supply until they're ready. If your baby needs extra support to breastfeed, we can help. We have lots of different approaches and adaptations to try. We can say that if your baby needs time to transition from tube feeding to breastfeeding, we'll help you make a plan and show you what's worked for other mothers. We can say maybe many babies with this condition are able to maintain an inclusive breastfeeding relationship alongside any supplementation that might be needed. And if your baby needs extra calories from formula, remember that nutrition is only one part of breast milk, and there are many unique and powerful immune components in your milk that only you can provide. Because positive language really does make a difference, and so do positive stories. We need to share our stories of hope far and wide. There is power in telling our stories, and when these stories involve beating odds or overcoming in seemingly impossible challenges, the ripples really can change the world. Remember my Tessa? So Tessa spent 5 weeks in NICU. She had tracheostomy surgery. She was exclusively tube fed at discharge. And she was completely unable to make any sound because of her trachea. And we were sent home with an oxygen saturation monitor to let us know when she cried, the assumption being that we would attach it to her and put her in a cot. And when she cried, her oxygen levels would dip and we'd hear the alarm. But I had promised Tessa, while holding her hand in NICU, that when I got her home, I wouldn't put her down. And I kept my promise. She was worn in a sling every minute and slept beside me in bed. She never needed to make a sound. I was there. And I lasted about 2 days with the tube feeding at home. She threw up another feed. She threw up the feeding tube, and I had just had enough. I knew that she could breastfeed, and I decided that this was it. I swore I was going to get her to breastfeed. And I think that first latch maybe took half an hour, but I got her latch done, and I fed her, and I cried with relief and exhaustion. Now, thankfully, I had access to the best breastfeeding support in the country through the Leche League. My amazing friend and a Leche League leader, Carol Smith, had already been an incredible source of support while we were still in hospital, calming me down when I thought my milk wasn't going to come in, helping me make my voice heard in NICU. She even contacted a lactation consultant in New York who specializes in airway issues, and sometimes she simply listened to me crying down the phone at night. Now we were home, she was confident that we could make the transition to breastfeeding. Getting Tessa to latch, though, proved incredibly difficult. Laid back positions were completely out of the question as her trachea came out further than her face. She had no hunger cues due to weeks of scheduled tube feeds. She wouldn't open her mouth, pressure on her chin didn't work. Now, Carol was able to assess us and found that she had good rooting reflexes, but she would not latch or suck until she felt pressure on her palate. So we found that she would feed well from a bottle and then began trying every trick in the book to transition to breastfeeds. Now, we talked about why Tessa might have such difficulty with latching, and we wondered if smell, which was a sense that Tessa was lacking completely, perhaps played a part in those reflexes. Now, that's something that we're never going to know for sure, but it is a good reminder to everybody to avoid any strong scents or perfumes when you're trying to get a baby to latch. Now, I had to try everything to get Tessa to feed. I would walk and bounce her to keep her calm, sometimes using a sling because I didn't have enough hands. I'd start her on the bottle, use bait and switch method, and an exaggerated latch. I needed one hand to keep my breast from blocking her tracheotomy tube, and another to shape my breast so she could latch, stopping to suction her tube when she needed. So it was a complete juggling act. I honestly, even looking back now, I have no idea how I managed that with only 2 hands. So one thing that I want to talk about is one of those issues, which was my breast blocking her tube, her trachea tube, whenever I was trying to feed her. Because finally, last year, the first ever case study for breastfeeding a trachea-dependent neonate was published. And in it came the recommendation that I have known for quite some time now, which was the flexible tube. So when I do this talk live, I have my 2 lovely assistants, which are Tessa's 2 dolls, baby John and baby Jane. And they each have a different type of tube. So as you can see from the picture, baby John has a straight tube, which comes straight out. So when I attempted, which is the type that Tessa had. So when I tried to feed Tessa, the tube immediately my breast tissue would just get sucked in there, and I would have to hold my breast away from that tube. So when you also need to do breast shaping, this just becomes a nightmare. So what I discovered was that there is another type of tube that some babies got. A lot of babies get this type whenever they're being attached to vents and stuff. But sometimes in the tracheostomy group, babies would just be given this type of tube because it's what the surgeon liked. But what it meant was that those mothers found it much easier to breastfeed because there is no way that you can occlude that tube in any position. So it would have been so much easier to feed had I been able to have access to that, or had anybody even considered that that might be a solution. And now, thankfully, once you Google breastfeeding and tracheostomies, this wonderful paper comes up in which they suggest using the Bivona FlexTend tube if available, so it can be positioned to avoid occlusion by breast tissue. Now, this is a real celebration for me and any other trachea mums who would have been kind of shouting about this issue into the void for a few years now. In this study, of course, in the paper, it also says that infants with complicated clinical course have been shown to benefit even more from the provision of breast milk, which is what we talked about. However, they are seldom encouraged to feed directly at the breast. And there are no reports of successful direct breastfeeding in an infant with a tracheostomy. No, I mean, I fed Tessa for 6 years, but it's just that it had never been published, and lots of other mothers had breastfed trachea babies. So it's wonderful that these doctors took the time to write this paper up and make it public, so that this will definitely help. Yeah. And so, besides world-class breastfeeding support, I had amazing family support. My husband never questioned why I needed to devote my time to breastfeeding, and my mom and aunts helped look after me, my other children, and the house. And as for knowledge, I was actually training to be a breastfeeding counsellor, but it was my older baby who taught me that breastfeeding was worth fighting for. I'll be so ever grateful for my daughter Cassie, Tessa's older sister, for teaching me exactly what I would have been giving up had I stopped fighting. And I never lost hope. When Tessa wouldn't latch and I felt like a failure, I would remember that she had latched before, that she could breastfeed, and that I couldn't stop, that I had to keep going. And then, day by day, feed by feed, latch by beautiful, painstaking latch, it happened. By 8 weeks old, Tessa was an exclusively breastfed trachea baby. And finally, everything felt right. And from then on, nurses were our everything. Tessa would have multiple general anesthetics and operations over the next few years. We're at 19 and counting so far. And it's impossible for anyone who hasn't experienced it to fully understand what it meant to us. One of the worst things about watching your child in pain is feeling helpless. But being able to comfort her, soothe her, ease her pain, nourish and support her body, and help it heal by breastfeeding was the most priceless feeling ever. It's crazy to me that anyone feels it can be reduced to mils on a fluid intake chart. There's no chart that could possibly measure the enormity of what I was giving her. And it's impossible to know how those feeds feel until you've experienced that fierce love and overwhelming joy that floods you when your baby is placed back in your arms. The relief and ecstasy at how those first little sucks make your whole world right again, and you can breathe. And on an earlier slide, I mentioned how breastfeeding provides pain relief. So I remember nursing Tessa after one particular operation. She was 2, so it's the top and bottom picture on the slide, the middle 2. She was 2 years old, and she had just had a nasal implant inserted via a bicornal incision, which went from ear to ear over her head, and they basically peeled her face off and screwed an implant into her mid-face. It was closed with 150 stitches, and there was a drain. Now, the next day, when the local analgesics had worn off and the nurses kept coming by and asking me, did Tessa need pain relief? I had to keep saying no, because Tessa hadn't complained of pain. She would just lie in my arms and nurse quietly, and then she'd come off and she'd go, ow, and she'd latch back on again. It was like having morphine on tap. And she got to share. So we had our first tandem feed when she was big enough where positioning allowed. And she shared nurses with her big sister for 2.5 years. And later she shared with her little brother, and she weaned not far off her 6th birthday, which was quite an incredible breastfeeding journey. And I do want to take a minute, though, to talk through something that we learned through pregnancy. So as you can see there, she's nursing quite happily with my big bump. But at the start of that pregnancy, what happened was my milk dried up. So I'll share this next slide, which is poor Tessa looking very poorly. So Tessa's BAM syndrome, her condition meant that her lacrimal ducts are incomplete. It basically means that her drainage tear ducts just stop somewhere in her mid-face. So Tessa had always had sticky eyes as a baby, and I had just got into the habit of dripping a little milk into her eyes at most feeds. at least a few times every single day, and we had very few issues. That was until I got pregnant. So I don't think anyone could have predicted just how much my milk had been keeping infection at bay, but within a couple of weeks of me getting pregnant and my milk drying up, she was admitted with periorbital cellulitis and was on IV antibiotics over Christmas. And I had the worst case of hormonal mommy guilt ever. But I can see now how incredible it was that basically my milk had prevented this for nearly 3 years. So, and I have heard from families with her condition that other babies were basically just on antibiotic eye drops from day one. And mostly they end up having to have surgery to remove the lacrimal sacs, which is a surgery that Tessa had a couple of years ago. Once I had finished breastfeeding anybody and had no milk to give, we did need to put in a permanent solution. But for 3 years, my milk kept it completely at bay. And then for actually about another 3 years after that, while I nursed her brother. So this is the part where I'm going to ask why everyone cares. So I know why it's important to me. But why does it matter? Why should it matter to everyone? And as Dr. Powell said in the last talk, a simple answer is because it's the right thing to do. So we all know the reasons why breastfeeding is important to each mother and baby. But why should you care? In the same way that inclusion, disability rights, and accessibility benefit all of society, helping these babies to breastfeed elevates breastfeeding knowledge for everyone. So it's a great example of what's known as the curb cut effect. So that's what they call in America, those little ramps that go up and down our footpaths. So they were first used in California in the 1960s to address the needs of wheelchair users. But of course, they're now used the world over by everyone, by parents with buggies, businessmen with suitcases, workers with carts, cyclists, scooters, many others. The same way subtitles were developed for those with hearing impairments, but they're now used by anyone in a noisy environment, or when you're trying to watch Netflix and you're trapped under a sleeping baby, or when your partner is crunching crisps so loud that you can't hear the latest scandal in Bridgerton. So there are loads of examples of the curb cut effect that we all now benefit from, which show that the steps we take to take care of the few positively impact the many. And when we're looking at, improving breastfeeding rates, I'm sure the assumption is always that, you start with the very basics and the easiest solutions. But what if we flip that? I mean, if we start and really try to maximize all the support for these babies, I mean, if you can help a mum to establish breastfeeding after a period of tube feeding or after heart surgery, when you can't use any of the normal ideas, any of the typical positions for non-complex cases, you're forced to find new ideas, new workarounds. You have to get creative and think outside the box. And inevitably, these little tools and tricks and ideas will benefit everyone. What we can learn from supporting breastfeeding in complicated scenarios is so wonderfully valuable for all mothers and babies. Because I mean, who couldn't use more ideas for positioning when nothing else seems to work? Who couldn't use new tips for getting babies back to the breast after a nursing strike, or approaches to manage sleepy babies? Who knows what we could learn? And it matters because I still get messages from all over the world from people who managed to breastfeed their trachea baby because they found our story online and it gave them hope. Messages like Sadie wrote back in 2018, she thanked me because she had a preemie baby and nobody thought that they would be able to breastfeed. And she managed to get him breastfeeding. And then they ended up back in hospital again, needing a tracheostomy. And again, they were told that you couldn't breastfeed with a tracheostomy, but she found our story and kept going, and they were home breastfeeding an extreme prem baby with a trachea. Sometimes you just have to know that it's possible. The same as this lady Kat, who in 2016 wrote that one of her best friends had a baby at only 25 weeks, and he needed a tracheostomy tube. And she's a lactation consultant in Germany and couldn't find any information about breastfeeding and tracheostomy. But whenever she was able to read that we had been successful, she was able to support her friend to breastfeed that baby. And it matters because it does this. That tiny baby with all those tubes and wires grew up to be the most beautiful, funny, creative, and all-around marvelous little human. Now, breastfeeding Tessa was one of the most impactful and beautiful experiences of my life. It helped heal me in ways that I can't put into words. It gave us our comfort and was our security in every hospital ward and doctor's office. And I will forever be in the debt of the people that made it possible. Breastfeeding children like Tessa can be fraught with challenges, and it can often look really different than most typical journeys. But I think she'd want you to know that it was always very, very worth it. So let's make sure that every baby with extra needs gets the same chance that she did. And I will leave you with this. Never underestimate the ability of babies to breastfeed, the strength and determination of mothers, and the power and importance of support. Thank you all so much for listening.
Gráinne, thank you so much. That was the most wonderful presentation, and I'm here with the tissues again. If you can hear it in my voice, that was so lovely. And we heard you speak this talk in person at our Leche conference in March, and there wasn't a dry eye in the house, and I'm sure that's the situation as well. I'm getting loads of lovely messages from people. Gráinne, I'm going to ask you a favor. Will you stop screen sharing?
Oh, yes, sorry.
Please. And I'd really like you, for the sake of everyone there, because we couldn't see you close up, would you please go through the tracheostomies again?
Oh,
please.
yes,
I'd love if you do that.
to.
Is that okay? I'm going to give you a couple of minutes there. Yeah, I'd love that. Thank you.
So what we've got, I was glad I was able to have a slide off it, because so this is baby John, which is our first trachea baby that I made Tessa, and this is nearly exactly what Tessa's face looked like. In fact, you could see from some of those pictures, you know, how close to the front of her face her tracheostomy came. This meant that whenever I was trying to get her to latch on, the tube just immediately just goes right into that breast, and you know, she's breathing through it, so you kind of like get a suction thing. And actually in the hospital, they made me keep on the there's a heat and moisture exchange unit, like a little Swedish nose that goes on the end of it to keep the air moist. So that came out even further, and they didn't like me taking that off. So that made it nearly impossible in the hospital. Now at home, I was you know, fine with taking it off for feeds, but we had this major problem where as soon as we're trying to get on, that is just right into the breast. And it was only whenever I joined the support group, the tracheostomy support group, which is another amazing support group, which I learned so much from, where I saw babies with tubes like this. And this tube had clearly been designed with vents and attachments in mind, but there's no reason that any baby can't have it. And some babies just did have it because that was the tube that was given by the hospital. And you can see then, even if this has got a moisture unit on the end, when you go to breastfeed this little baby, that baby can breathe absolutely fine, and we can latch on, we can get really close positioning. I could never bring Tessa's body close in. All of those things that we know help with reflexes, positioning, latching, you know, opening wide, that you know, tummy to tummy, and squeeze them in so their head tilts back. I couldn't do any of that. That was impossible. But with this tube, I could have had so much more, and I wouldn't have needed extra hands to both, you know, do that shaping for her while also keeping this tube out of the way of my breast. So this is a wonderful it's a wonderful improvement to have the paper that's online. I'm so delighted by it. And the other thing that I need to mention then is that I know I talked about Lindsay's book, Breastfeeding the Brave, multiple times. So that the tracheostomy issue isn't in this book because the paper wasn't out in time. But if enough people go out and buy this book, the next edition will include my really important information. It's not my information, but the really important information about trachees. So please, could everyone buy one of these for your unit so that we can get more knowledge out there and we can get the new version. Thank you.
Fantastic, Roy. That's really helpful because it's great to see that close up. You were a little far away. Well, I couldn't quite, I knew what you were saying, but I couldn't quite see it. Somebody has just said to me, when is your book coming out?
Oh, I have no plans.
Well, maybe you need to. People have said being in tears, beautiful, heart-wrenching story.
Thank you. Thank you.
Sowing the seeds of the marvel of breastfeeding whenever opportunity arises, and love that approach. And yeah, it's oh my goodness. Thank you so much, Gráinne. You're the most, somebody's just saying in the chat, I have learned so much from your presentation. It was beautiful and meaningful. I'm going to be crying again now. Your baby Tessa is so loved and has an amazing mother. Beautifully narrated and gorgeous photos and slide. Well done to you. And congratulations for such a fantastic presentation. And most of all, for successfully breastfeeding. So everybody's saying like really, really incredible. And I just, I really feel it's, as you say yourself, it is so important. Breastfeeding is so important for every baby. But, as we've talked about before, it is super, super important for babies, who just have those extra needs. And when you started your journey with Tessa, and then that grief and the emotion, but then you knew you were facing into like all those 19 surgeries. Well, as you were going along, but just to have the gift of being able to nurse is just invaluable, isn't it?
It's kind of impossible to ever really put into words what that meant in those hospitals. Being in hospital with the baby who's having surgery is just horrifically stressful. Yeah. As anybody who has been there will know. And being able to have something that you can do, that empowerment of you, where that the doctors have their jobs and the surgeons, and you have to rely on everybody else, and everybody's doing things for your baby, and you can feel really, really helpless. Being able to breastfeed through that was as much for me as it was her. It was so, we've talked about how healing it is in all sorts of aspects. Well, my goodness, because, my heart broke into 1,000 pieces every time I handed her over to those surgeons. But to be able to feed her when she came out through each one of those, that's putting those broken pieces back together. That is the healing that happens. And to take that opportunity away from a mother right at the beginning of her journey, just because that baby might look a little complicated, to not go the extra mile and extra effort to make sure that you're not looking at that baby just on day one or for the first week. You're looking at their childhood. There could be anything coming up around the corner. Please make sure that every single baby gets to that potential, that they have the potential to feed. Let's do everything we possibly can.
Yeah, and I think we talked briefly earlier about making assumptions, and to be open to what's possible, I think is so important.
What's interesting as well is that I've brought along another book, which is by a midwife called Indi McDowell, who is a midwife in Ethiopia, along with her colleague Etse, and they had a baby born like Tessa in their remote Ethiopian village. And now that baby did suffer some I think hypoxia at birth, and is kind of developmentally delayed, but that baby breastfed without any intervention. The mother simply had to take them off to breathe.
Yes.
And so when I look at how it was so assumed in the hospital that I wasn't like, I couldn't possibly, because she was like this, whereas somewhere else in the world who and they didn't have recourse to anything else, but that baby did feed. That baby was breastfed because there was no other way to do it. So I think sometimes we can be incredibly grateful for the amazing medical services we have, but sometimes it blinds us to the fact that maybe the simplest solution is just we could have tried.
Yes, yeah. Someone's just saying, excuse me, thank you so much for this inspiring presentation. It's so inspiring as a woman, as a former breastfeeding mum, and as a midwife. So somebody said would love the name of that book.
It's Two Souls, and I would recommend it to any midwives or anybody who's ever had a baby. It is stunning.
Lovely.
The stories are written both from first from Indy's point of view, and then from her colleague Etse's point of view. So you hear the same births recounted from the two. Honestly, it's so moving, so beautiful, and so inspiring. And you should follow them on Instagram as well.
So it's fantastic. Linda, we might open the chat. Yeah. Somebody else say, thank you so much, Gráinne. It was such an amazing, inspirational talk. I work in a very busy postnatal ward with women whose babies end up in the NICU for different reasons. Your talk today has helped to remind me of the mothers we often forget, unfortunately, and will help me going forward in my practice to protect those women. So that's lovely. Yeah.
Thank you. Yeah.
Yeah. Thank you so much. It's an amazing, inspiring story. Please do write the book. You speak about family integrated neonatal care. This is essential for optimal neonatal care. Do you and your support groups take the opportunity to advocate for health services to embrace this care?
Not so far. I have not managed anything like that. It's something definitely in the future that I would love to get involved in.
Yeah. Somebody's saying they've had the pleasure of meeting you many times. You have a lot of fans. The most recent time this summer at the Stenthole Festival in Helen Hancock's Breastfeeding Wagon. So I'm not sure if I'm pronouncing that well.
Yeah.
Where you and Tessa both looked festival gorgeous.
Crazy.
What a wonderful presentation. Thank you so much for sharing your wonderful insights on how to support mothers in so many different situations. Thoroughly enjoyed your presentation and presentation style. Thank you for telling your story of breastfeeding, Tessa. What an amazing insight into your NICU struggles. As midwives and peds and neonatal nurses, so much to take home. And problem-solving breastfeeding with tracheostomy, as well as continuing with daily life. What an amazing journey, and wishing you all the best in the future. So I really liked what you said about the curb cut effect. Isn't that just...
Yeah, there's so many amazing examples of that, I know. And when it's, we take those things as a given, and yet, whenever you actually break it down, that's what happens. Everybody benefits when we look after those that need the help the most. It's the same as inclusive parental rights. I mean, those kind of rights were put in place for same-sex couples, and yet there are many families who just have unusual dynamics that need, that maybe the father needed more time off than the mother, or those things benefit everyone.
Yeah.
So we have to stop looking at this as being an issue of oh, should we invest in this tiny demographic of babies who maybe won't be able to breastfeed anyway? Yes, we absolutely should, because when we help these babies and these mothers, everyone benefits in every case. I mean, the help that I was able to get, thankfully, because I already knew Leche League and everyone else, I have gone on to pay that forward, hopefully, and will continue to for many years. So we're, on those ripples will inevitably go out no matter what. And everybody who is involved in the care or the support of a dyad to breastfeed in unusual circumstances, everybody is learning. Everybody is learning in those situations, and that's what we need more of. And so nobody should be nervous or reticent to dive into those complex scenarios, because whether or not you think that you get the outcome that looks like success, you're learning all of the time, and that's what we need.
Can you tell us some more, Gráinne, about the Boston survey that you were involved in? I'm really intrigued by that.
This was really interesting, and actually does have a beautiful little breastfeeding twist to it. So when Tessa was born, her condition wasn't known. They called the fact that she didn't have a nose was simply complete arrhynia, which is just the absence of a nose. But there were doctors in both Boston and France who were looking at this condition and trying to find out the genetic component for it. And the ones in Boston reached out whenever they saw that I had gone public with Tessa's story, and she had a public platform and Facebook page and everything. And because people would get in touch with me, and I had already kind of maybe got in touch with about 12 to 15 families. And she reached out and said, like, we're doing this research, but this is so rare that we don't have enough participants. Could you help us? So I said yes, that I've already got these guys this, and we did some more publicity. We'd get more people in the group, more people reaching out, and some more people then were willing to take part in the study, and which meant that in 2017 they found the genetic cause and were able to classify the condition as BAM syndrome, Bosma-Aurania microphthalmia syndrome. For the first time, it is now listed in the rare disease database. And that was a major thing for us. Tessa was 4 years old at the time.
Wow.
And I would spend quite a lot of time with Dr. Shaw, who's the doctor in Natalie Shaw in Boston. And I remember one evening in my kitchen where I was nursing Tessa in a sling while I burned sausages in the oven, but that's I was nursing Tess in this thing, and I was pacing up and down the kitchen while on the phone to Natalie in Boston. And we were discussing how to move forward with the information, what to include in the overall page for the rare disease database, and plans for a patient database so that patients could get in touch with others with the same condition, support that kind of thing. And I remember apologizing at one stage because I had to switch sides. I think Tessa needed to just swap boobs. And she said, "Oh, are you nursing?" And I said, "Yeah." And she said, "I'm pumping right now." So there we were at either end of the Atlantic talking about very important medical things, while one of us nursed and one of us pumped. And I thought, that really does show you the power that women have.
Yeah, it's true, isn't it?
Sausages, though.
It goes back to Dr. Powell's talk earlier, the power of women.
Yeah.
The power of women to change the world, I think, is amazing. I really like that you said that breastfeeding is so much more than the milk. I was reading some stuff during the week from Catherine Watson Jenna, and I suppose because I used to be a physio, so I always come at things from that point of view. And that breastfeeding babies use all four limbs. They ground their feet. They get to wire their brains. They get to connect right brain, left brain, integrate all their organ systems. And breastfeeding is so important as a developmental process. And I'm sure for Tessa in particular and lots of other very precious babies, this is almost of more critical importance than, I'm sure you'd agree with that.
Yeah, absolutely, because you've got all of these things that we know that seem to be like little added extras, like, oh, it's great for jaw development and oral development and those eyesight things that we talk about where both eyes are getting adjusted whenever we swap sides and all of this. And that just seems like, sprinkles on the top of the ice cream. But when you talk about a baby who has medical issues, those things become profoundly important. They can be the difference in needing intervention and not, like where you're really looking at some huge impacts. And so, yeah, they're not just little added extras that are nice, like the fact that maybe they'll have less gastro bugs. Well, that's great in a baby who's perfectly healthy, but what if that baby has gastrointestinal issues? Now it becomes clinically really, really important that baby is breastfed. So yeah, I think for so many reasons we need to not look at all the added stuff. Like, they need to just be up there front and center. We need to be telling people more about how it impacts a baby's full system. I mean, there isn't a system it doesn't affect. It's completely comprehensive that way. So yeah, I would love everybody to know more that that the baby's vestibular system will be optimized because of breastfeeding and baby wearing. So that's, again, nobody really is going to choose that as their reason for breastfeeding, but your baby maybe has a neurological condition or a spinal condition where these things are going to make a massive impact as to, how quickly they might be able to walk or gain abilities, or like you said, in the physio aspect, like that's huge. Let's, if you can optimize a vestibular system, let's do that.
Yes. Yeah. It comes with the milk, it comes as you say, not an added extra, but part of that
Yeah.
whole delivery system. And, you know, and I just thought about your slide of Tessa when she had that really severe eye infection. That is so incredible, isn't it?
We had no idea that we were keeping that at bay the whole time.
Yeah.
And we were literally just holding it back.
Yeah.
Because as soon as I wasn't dropping that milk into her eyes multiple times a day,
Yeah.
like she ended up in hospital, and it was really sad. And it happened so quickly. Like I would have had antibiotic drops and everything at home, and it was just boom, so severe and so bad. And like I said, with other kids with the same condition, I mean, I've seen them in much worse states than Tessa's, and needing multiple hospital admissions for that one condition alone, for one issue. So yeah, I mean, it was something that I never even thought about. Her eyes were a little sticky, so I just put a little milk in. No.
Yeah.
And people think that that's a nice thing to do, but like it was a health intervention that I was doing. I didn't know I was doing it, and I wasn't told to do it. But if we can, you know, disseminate that knowledge to the public, I mean, then won't they value breast milk so much more if they really know how powerful it is? And we have loads of these anecdotal stories, so it'd be great to have some, you know, proper studies backing this up. But you know, I know what it did.
Yeah, it's true.
I was feeling very bad about it in hospital while newly pregnant and nauseous.
Yes. Gráinne, if you had the gift of time travel and a magic wand, and you'd go back to the beginning, what would have really made a difference? I know we've got a lot of nurses and midwives and people in the NICUs here. What would have made life easier for you and Tessa going way back?
So there are a couple of things. First of all, everybody believing that baby was going to breastfeed would have really, I mean, if they had really believed it, that have just given us the time. They'd have given us the opportunities that were really given quite begrudgingly. You know, like if I said, please can I try to feed her, or please can I take her tube out so that I can feed her, it was like, no, we don't do that, and we're not going to, because she's scheduled to feed for now. And you know, and this was back in the old maternity unit and at the Royal as well, so they had to wheel in the World War II the squeaky curtains to come right every time I asked. So I mean, I very quickly just stopped asking. So yes, everybody believing it for a start, being given far more time and opportunity. The other thing is that once, you know, the insistence that we stayed at NICU was a major factor that really hurt us. And that was simply because the policy said that a baby with a tracheostomy was an automatic NICU resident. But Tessa's trachea was for a reason that hadn't been written yet. So it would have been lovely if someone had looked at that as a case by case situation and said, well, yes, I know the policy says that tracheostomies are a NICU, but this baby isn't using a single machine.
Yes.
So this is an exception. And that baby, because it was detrimental to both of us, for both of our mental healths and my physical well-being, and the fact that it was so incredibly stressful and prohibitive in so many ways. If somebody could have looked at us as individuals and not simply just read the policy and insisted and enforced, that would have been major. Our lives would have not been quite as difficult. So yeah, believe the woman and look at each case as individuals. I think those two would have made life very easy.
Yeah. I was at the ALTI conference at the weekend, and somebody put a slide up from Sweden, I'm going to say, just somewhere in Scandinavia, with apologies. And in the NICUs, you had the technology, and then beside it was a full-size adult bed for, you know, wouldn't that just be?
Yeah, so I didn't even have a chair. I mean, I was trying to breastfeed on a stool, basically, which is another reason why the swelling in my feet had become so painful.
I know.
So yeah, there wasn't anything, and nobody made any effort to change that and I was the only one that was there, you know, and we was there for weeks and weeks. So yes, the idea that we need to keep mothers and babies together, that being important to NICU, it would really change, I think, so many people's start, and those babies. It would empower mothers to stay. I would have slept on the floor beside her if they'd let me, and they give me such a hard time for staying. So I would love it if those ideas would really shift, and we could really bring the mothers in to be a part of the care that is given, and would value us as, rather than looking at us as being in the way. And the same as, for each medical procedure, I was made to leave, whereas I would much rather have been there with her. So this idea that babies don't know that their mummies are there or not, or it's not going to matter, like, I think both of us would have benefited from being together no matter what was happening.
Yeah, I can understand that. And it's really fascinating what you're saying about the mental health aspects for the babies.
Yeah.
That the birth weight doesn't come into it.
Yeah, so that's fairly new research. And of course, they're going to have to research that a whole lot more. But I think most people's assumption would have been that it was the very tiniest, sickest babies that would have had, had the worst outcomes. And actually, it's just being in NICU.
Yeah.
Being in NICU is a factor. And so, I think more work is needed to support those dyads when they come out, to really, that's what breastfeeding did for us. It is that connection that we needed to regain. But if breastfeeding isn't going to be possible, there needs to be more support to make sure that those mothers and babies, parents and babies are being connected and getting healed from what they've gone through. It's not this idea that once you go home, everything is suddenly rosy and you close that door, because the trauma kind of lives with you.
And we referred earlier to how healing breastfeeding is, and I think you and Tessa epitomize that so much. Someone's just saying you're a superstar. Isn't it incredible? Isn't it incredible what women can do when someone says no to them?
Oh yes, exactly. And this is another one. I mean, I'm sure everyone comes across this in any group of breastfeeding mothers. Like, what is it that made you keep going? And it's pure stubbornness, determination, and this idea that you're going to prove everybody wrong. Yes. And I remember going back into hospital with she was just in for something, and she was doing so well, and she was exclusively breastfed, and I was so proud of that. And I brought her back into NICU to kind of show off. And one of the consultants, a male consultant who had been really lovely, when I told him with this big proud face that she's exclusively breastfed, he went, "How does that work?" And I thought, you were supposed to be helping me. And he, of course, had clearly never believed that she breastfed, because he didn't even understand how. So yes, I did enjoy sometimes proving everybody wrong.
But look, I always think, the work that you do, Gráinne, and having had that experience and the grit, I suppose is the word that comes to mind as well, makes that so much easier for the next mother coming in. And
because they can easily just point and say, well, she did it. Let's give it a good shot, because I know somebody else that was able to do this, whereas I had nothing. There really wasn't anything, just this idea that maybe it was possible, and maybe if it worked like a secondary, maybe we could. But I would have dearly loved, which is why I wrote about her story. I mean, I just couldn't let another mother go through what I had and not just be able to Google, is this possible, and at least find one story that somebody says, yes, it was possible for us. So it's at least worth trying. It's at least worth giving it your all.
Yeah, absolutely. And somebody makes the very, very important point as well, that the other parents, including fathers, who often don't get as much access.
No, that was because we were forced to stay in NICU. Then he had nearly no time at all with Tessa, which is horrendously difficult. So if we had been transferred somewhere more suitable for us, we would not have had that when we didn't need it. Like, NICU is wonderful when it is needed, but we do need to make sure that we're not putting people in there that don't need it. And poor Nathan was back at work and looking after 2 toddlers at home, and horrendous start. I do sometimes wonder how under God we did it all, but
I was just thinking that you probably do wonder how you survived. Somebody say breastfeeding or not, separation in NICU negatively impacts all families, which I think
Agree.
is, yeah,
Absolutely
yeah.
agree.
Someone else saying, what a journey, so inspirational. And we say a person to mind you, the mum too. The new children's hospital in Dublin will have family rooms. So progress is happening.
Yes, wonderful to hear. Wonderful.
And we need this in all NICUs too.
Yeah. Although I will mention that the NICU in Belfast had 3 family rooms and they wouldn't allow me to stay in either of them.
Oh.
So I begged them and eventually told them that I wouldn't get under the covers. And I lay down on top of the bed with my coat over me for the 5 weeks that we were there.
Wow. That breaks my heart. Yeah. Yeah. Oh. I'm sure you know Canada has room for family in the NICU. Someone saying, thank you for your wonderful talk, Gráinne. Why was the evidence that we have many years not transferred into NICU policy? Why?
No, so
care.
I would love to know why it was taking so long, and I hope things are different now, 10 years on. But at the time, in the family room, there were leaflets talking about kangaroo care and skin to skin. But I sat in that NICU with Tessa for 5 weeks, and I did not see anyone get skin to skin or any kangaroo care given. So it was lip service for most of the part.
Yeah,
you know, the leaflets were there, and you know, checked some boxes, but it didn't happen in reality.
Yeah, and you're being agreed with here. We've known this for years, that the policy in NICU does not reflect the evidence. Such a powerful story, and what a wonderful advocate Tessa has in you. As an allied health professional, I've taken such inspiration from your story. You're amazing, and I hope you continue to keep sharing you and Tessa's story so warmly and powerfully. And you know, you talked earlier about the power of the internet, and I think the power of the internet as well, where you were able to connect with, you know, that doctor in Boston where you had your shared
you had to go global
experience.
I mean, yeah.
You know,
Tess is the only one with her condition in all of Ireland. We know of 2 more cases in the UK now. And you know, in most countries in Europe, there's maybe 1. We've got a few in America, and then you know, the non-English speaking parts of the world are slower to get in touch because the language barrier. But I have maybe 40 families now in the support group. But, you know, we had to go global, and I think that's the same as breastfeeding in any kind of complex case. Use the whole world. We've got it. We have access to it. So you know, if you don't have anybody who can support you locally, find someone far away, because there are specialists in most things if you look far enough.
Exactly. I was just going to say that you've, because of the power of the internet, that you have been an incredible support to all of those families. The support that, as you say, you didn't have 10 years ago. Yeah,
that's what I couldn't. I could never have just sat and then known what we knew, and you know, watched Tessa grow up and be as wonderful and fine as she is, without making sure that nobody else had to sit in those early days and wonder if she'd even live. You know, like I didn't have that information. I didn't know if my baby was going to develop normally. I didn't know if this condition was going to be life-threatening or cut her life short. I had no information. I just had to take it, you know, hour by hour. So once I knew that these things, and they make life so much easier, you know, like, so yeah, I had to make sure that anybody else who would look this up, and which has been so lovely in the past few years, is that we've had people who with an antenatal diagnosis be able to get in touch with us even before the baby's born, and people, you know, who are still in hospital, just had the baby. So really from, you know, day 1, they've been able to be in touch with us, and for us to say that it's going to be okay. And, you know, look at Tessa, she's great. Everything's going to be fine. And we're here, and, you know, we just have so much more information to give people now. So yes, while it is still incredibly rare, it does make the world of difference to every family that we are able to help.
Absolutely. Somebody's just saying how lucky Tessa was that you had already breastfed before. Do you think that made a big difference?
Oh my goodness, I am so grateful. There's no way. There's just no way that I would have fought through that if I didn't know what we were giving up. So that was absolutely crucial. Yeah, my lovely Cassie had been the most beautiful, straightforward feeding journey and had inspired me in so many ways. I mean, that's what inspired me to become a Leche League leader, was, you know, her journey. It wasn't Tessa's. It was, I had fed Cassie and I thought, this is incredible, and I want to do what these incredible women do. And so I knew how good it could be. And that's what kept me going. So yes, Cassie will always be a huge part of that story because of what she was able to teach me. I'm so glad I had fed before.
Yeah. And you knew in your heart that Tessa deserved to have that experience also. And you fought for that.
Wasn't going to give up on it.
Yeah, absolutely. Well, Gráinne, we at the Leche League are just so proud of you. And obviously we've known you a long time and known Tessa a long time. And thank you so much for giving up your Sunday afternoon to share your story with our audience today. So, and thank you to everybody who's here. And we're going to wind up now. So thank you, everybody. Keep an eye on social media and everything, because we will hopefully run more of these events. And we enjoy doing them. You know, it's a great way to engage with a wide variety of health professionals. And there's Kay, who is our co-area coordinator of leaders, and Linda, our conference organisers. And please go to our website, La Leche League Ireland, and see what's happening, especially for Breastfeeding Week, and wishing you all a really, really, really happy Breastfeeding Week. So thank you, everybody. Slán go fóill, and until next time, good day, Slán.